Hey guys, this is Nurse Shar back with another video. Thank you guys for continuing to watch my videos and leaving comments and questions under my videos. It keeps me motivated to keep going and to keep uploading videos. I did take a break from making videos, and I'll tell you guys why. As you know, some of you guys know, I am currently in a bridge program, the LPN-RN bridge program. So it's been quite busy. 2 semesters down, 1 more semester to go. So I just wanted to give you guys an update. So this last semester I took, of course, we had clinicals, we had a simulation lab, we had med-surg 2, and we had maternity. So it was quite busy. Oh, and biochemistry. Some people, you know, they take that as a prereq, but for me, I didn't, so I had to take that along. It was included in the program as well. So those were the classes that I took for this past semester. I survived. I actually made the dean's list, thank God, which was really, really hard because even though we were physically in school for just 3 days out of a week, that's still like a heavy load of classes that I had to take. And so people will look at it like, okay, you're only in school for 3 days a week. That means you can work for 4 days. But anybody in nursing school knows, like, if we can work for 0 days, like while we're in nursing school, that's the perfect amount of time for us to work while we're in nursing school. So it was a heavy load. On the weekends or depending on like what time we have, like after class, sometimes I will pick up like agency shifts because we still have bills to pay. We're not rich. We're not rich, so I still have bills to pay. So that was the way I tried to make sure that I still had income while doing a bridge program. We had to take 2 HESIs this semester. Both of them were in maternity. We didn't have one in med-surg, surprisingly, but from what I hear, next semester they're gonna definitely compensate for us not having one in med-surg this past semester. Anywho, so I'll tell you about how that went. So maternity is not my strong suit. It's not. I'm one of them people where, like, if it don't really intrigue me much, like, I'm not gonna say I struggle in it, but it's just not my strong suit. So for me, maternity, I just did not expect to pass with an A. We had 2 HESIs. The first HESI, I studied a lot. Like, I was heavy with the studying. I did some Saunders questions. I did some HESI questions. I did a lot of Professor D with Nexus Nursing. Like, if you just watch her videos, then you will understand when I say I watched a lot of her lectures and did a lot of questions. You know, she do a lot of questions with her lecture, which helps a lot. So that's what I use, the Saunders questions, HESI questions, and also Professor D to help with some simple nursing with some other ones. And I ended up passing my HESI, my first HESI, with over 1,000 points, which I was very surprised because I got my LPN nursing before the next gen NCLEX came out, so our questions were different. So with this HESI that I took, it was like a next gen HESI. And to me, I don't want to say it's harder, but it really make you think more critically versus you just going question. It's more of like case studies, and you doing a step-by-step with your case studies. So, you know, I was surprised I got what I got. Like, I know I'm not dumb, you know, because you do all your studying, but you know, sometimes even with all the studying that you do, you don't always get as good of a grade. So I like prayed my whole way through, y'all. And then when I saw that grade, I was like, this gotta be a mistake. But I ain't gonna speak on it because it was the perfect grade that I needed. Okay, so I did pretty good on my first HESI. The second HESI, I didn't do as well on. Hold on, y'all. My little light done went off. Hold on 1 second. Y'all gotta bear with me. I am recording in my car, y'all, and let me tell you why. So there's a lot of construction going on. There we go. This tacky, y'all. Don't talk about me, but I'm trying to make this video. I need a video. All right, so there are some constructions going on in our apartment complex, and I'll insert a video to show you guys that as well. But that was the reason why, like, I couldn't really record in my house for a while. I was mostly recording, well, not recording at all, but that's why I'm recording right now in this car. But anywho, the second HESI that I didn't do as well, but I still passed it. I only had 3 packets to do. It was like a 9 something, but it wasn't in over 1,000 like the first one was, which was my fault because honestly, I didn't study as much. I got a little cocky. It humbled me. Humbled me real quick, baby. Humbled me real quick. I was like, wait, hold up. Wait, I don't remember this stuff. I didn't study much. I was in ER one of the days, and then the other days I was like, well, you know, I'm not tripping. You know, my grade is good for the other HESI, so I was like, I got room for error. And so I really, y'all, when I say I didn't study much, I did not study much at all, and that was my fault. And so, you know, thank God I still passed. I still got a good grade, but definitely could have got a better grade if I would have actually studied for that second HESI. So ultimately, for all my classes, I did pass them with an A, but that doesn't go without studying all the time, making sure you stay, you know, on your assignments. I make sure that I keep my agenda, and I take it week by week in my agenda. So like for this week, we got this going on in clinicals, or we got this going on in this class. So I take it week by week. And just kind of go from there. That way I know what to study and what to focus on. Some classes, they don't care what's going on in your other classes, baby. You will have exams every single week. Like 5-10 chapters, like every single week, especially because I'm in an accelerated program. So some classes, they can care less. Like you will be taking multiple tests in one day. For my med-surg, it's advanced med-surg for that course. And for my maternity course, thankfully, I had the same professor for both of those courses. So sometimes she tried to kind of switch it up, like exam for one class this week, exam for the next class the next week. And some weeks she was like, look, y'all, we grown. we gotta get these tests in at the end of the day. Y'all grown, y'all in nursing school. This is what we gonna do. So we did have a couple weeks of that, which was very, very helpful. We had clinicals every Monday at the hospital, and I want to tell you guys how that went. I'll give you more details in another video, but I love these clinicals, okay? Most clinicals you go to, you have to stay on that same floor every time that you come. So for this term or this semester of clinicals, I was in the ER, I was in the ICU, I was in step down. Like, it was such great experiences. I gained a more huge, I don't know how to say it right, but a more huge respect for RNs now that I got to experience working or having clinicals in the ER and in the ICU. When I was, well, I am an LPN, but like working as an LPN before I went to RN school, I was like, oh, we the same, and you know, LPN or RN, we still the same, blah, blah, blah. We are not. Like, we are not. Nobody is necessarily better than the next, but to be a RN and to work in those departments, not in long-term care, but to work in those departments of ICU, ER, step down, things like that, you really have to think critically, and you really have a lot more autonomy. And with that autonomy, of course, comes responsibility. However, like, they really have to think on their toes. In the ER, people come in, and a lot of times, you know, they have like certain protocols for certain orders. So the nurse done probably been with that patient for like a whole hour, 2 hours before the doctor come in. So you already assessed them, already ordered labs, and then all these other things before the doctor even seen them. So you have that as autonomy. You already draw your own labs. So your girl did a couple IVs. Like, I'm used to IV medication, but I started a couple IVs, and I was so proud of myself. Most people, especially in the ER, if they're coming to the ER, they don't want you touching them. Like, they like, look, I don't feel good, don't touch me. But a few people in the ER did allow me to insert their IVs. And then also when I did ICU, I did a couple IVs as well, because of course in the ICU you have to have multiple sites. And then also in the ER you have to have multiple sites, especially if you're doing blood culture. So I was able to really practice my IVs, hang bags, learn about labs. Because of course, like in long-term care, like you look at the labs, you order the labs, but to really know, hey, when to call the doctor. Some stuff was, the lab wasn't abnormal, but you can see that it was trending up or trending down and about to get there. And I was like, wait, it's not in red. And the RN was like, but look at it, like it's increased from when we just drew it. I'm like, oh shit, so you know. So it's like it's like those kind of things that was like, we're educated on how to recognize when there's a change, but we always think highs and lows. We don't never think when it comes to labs, like look at the trend. So that was one thing I was like, oh, I like y'all. All right, so that was in the ER. The ICU, I'm gonna be an ICU nurse. Like, mark my words, I'm gonna record, look, I'm gonna screenshot this part of the video. Baby, I'm gonna be an ICU nurse. I have the utmost respect for the ICU nurses, okay? You mother suckers are smart. They have people come in on, I call it flight for life, with the helicopter. They come in, helicopter through the ER, then get sent right up to the ICU, and the ICU nurses, sometimes they come right, you know, if they're being transferred, they come right off that helicopter and come right to the ICU. And these nurses are seeing these people come in, intubating them, well, helping with intubating them, having like 5 different IV bags, and then like switching over the bags from what the paramedics from the you know, the airplane, from their had. And I'm stuttering because y'all, that's how fast it goes. They're like boom, 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 boom. And those nurses and ICU nurses be on it. Okay, how much this is on? Okay, boop, boop, boop. They promenade pump, because you got to move the patient over, the IVs over. You got to make sure everything is right. Like when I used to watch those TV shows, I would see a patient that had like 5 or 6 IV bags hanging. I'm like, that's excessive. But then I go to the ICU for clinicals. I'm like, now I see why. Like, this is to keep them sedated. This is to help with their pain. This is to, you know, help with the blood pressure. It's like so many different things, y'all. I just love the ICU. I'm going to be an ICU nurse. Like, I know it. I feel it. Every time, like, my clinical instructor was like, who want to go to ICU? That's me. Don't ask nobody else. Don't ask nobody else. Let them go to the med surg flow, baby. I want to be in the ICU as an ICU nurse, okay? I have the utmost respect for them. I look at them and I'm like, y'all are so smart. Like, you go on the med surg floor, you have like 4 or 5 patients. Then you come to the ICU and they have 2 patients. You was like, oh, you know, I used to think like, oh, it should be smoother for y'all. Y'all only got 2 people. It literally takes so long to care for those patients. And those ICU nurses are so compassionate. They're so smart. They have the best teamwork, because a new admission come in, you don't see just that nurse who's assigned to that patient come in. The whole ICU of nurses come in and help with that admission, help them get transferred, help, you know, set up the IVs, help get any orders. A doctor come in and they have like 20 orders. You have 1 person putting them in, 5 people transferring the person, like so many things. You got respiratory that's coming in and, you know, putting them on ventilators, like whatever needs to be done. And this semester clinicals really like hype me up, like to be like, regardless of how hard nursing school is, I'm going to do the best that I can to just make sure that I can continue to be the best nurse that I can be, but also just to stay as educated as possible. Because when you have that autonomy, you got to be able to know, okay, this is what I should do and this is why I'm doing that. And so I'm just going to make sure even after school that I stay educated. So I just wanted to give you guys like an update on how my semester went. I am so excited. I'm nervous. I'm exhausted because it is a lot. However, I'm excited and I'm happy and I'm looking forward to this upcoming semester, which will be our last semester. We are done with that at the end of April. I'm hoping to bring you guys, of course, another video way prior to that. But again, it's a lot with working and being in school and having clinicals. It really is a lot. So if you guys have any questions, still drop any questions, comments down in a video. I respond to every comment. And of course, in the meantime, I will work on getting you guys videos. You see, look, I am recording from my car, so I'm trying to be dedicated, y'all. I had to get something in, okay, to get you guys, make you guys aware that I haven't left YouTube. I haven't stopped making videos like indefinitely. It just was a lot on my plate with school and trying to work. And my son, he's 16, about to be 17. He getting a haircut back there, or wherever that's at back there. He's getting his haircut in one of the suites that's back there. And he drove us here. So, you know, my baby growing up. I'm growing up. And we're just growing up together. So thank you guys for watching. Any questions, comments, drop them below. Like, comment, and subscribe, whatever all the other YouTubers say. And I'll see you guys in the next video. Bye.